If we called your last manager or your last supervisor, what would they tell us about you?
Let's see here. They would probably tell you I am very punctual. I love to show up on time always. No, but that's literally no.
That's what they
I'm
want to
really
hear.
punctual. Yeah, no, but yeah, I remember I would always show up and she was like, "Wow, you are always here on time." I was like, "Well, yeah, like duh, what?" But yeah, no. I think my supervisor would tell me that I'm really punctual and also, reliable and just a great team member to have because I really like to support my other coworkers. Um, yeah, I can't think of
Oh,
anything else right
no, that's
now.
good. Because we haven't talked about
Okay.
that yet. Like
Okay.
most people talk about that at some point, like enjoying
Mhm.
being a good team member, you know? That's perfect.
Well, my last supervisor will tell me that I am very good at working in a team. I'm a good team player. Especially I always make sure that I show up for the team. I don't really miss work. I always show up, especially if there's no emergency, unless there's emergency. There's emergency, of course, but I always show up. I always make sure that my colleague know that I am dependable. They can always depend on me. They can rely on me, especially making sure that we provided care for all the patient on time, and I am loyal. If you can see on my resume, like my resume, I've always stayed there for 6 years for my for my previous employer. So I am loyal, and I am also very punctual. I always arrive on time, and I was never late, especially not only on my previous work, but I also on my senior my clinical rotation, senior preceptorship, also in my school. I was never late because I think time is valuable for everybody, and also uh, I'm a very receptive with constructive feedback and always have a growth mindset. And I can take this feedback in order to improve myself and not take it like personally, because I know that this constructive feedback is coming from a place that they're concerned because they want me to improve. And also, my supervisor may say that I'm hard worker because I really value work ethics, and based on my of all the work experience that I have experienced, I developed this strong sense of responsibility and accountability to make sure that your time, your money that you pay me is worth it.
Okay. If you find these videos helpful and you want to grab your own list of nursing interview questions, over the years I've collected every question that any new grad has told me they've been asked in their new grad nursing interview, and I've compiled it into a 22-page, 72 question PDF that you can download. It's $5, but with your discount code, you can get it for $3. So your discount code will be just YouTube. So I'll put the link in the description below. Go ahead and check that out if that's something that you think would be helpful. The idea is hopefully you'll encounter any questions that they're likely to ask you to help minimize any surprises during your actual interview. What if they ask you like what your instructor or your last manager would say about you if they called?
Definitely, yeah. So, in my practicum, I had two meetings with my clinical instructor and with my preceptor that were just kind of like midterm and final evaluations of my progress. And in both of those sessions, my preceptor was very clear that I was very safe. That's kind of how she explained. Like I knew what I was able to do, and I communicated that. And if there was something that I was ever unsure about, if there was something that I wasn't totally confident in my skills, like I was comfortable coming to her and being like, hey, I know you showed this to me, last week, but I can't quite remember. Like, do you mind going over it with me just one more time? And so that was something she kind of verbatim said. And I know that that's really important in critical care, is like, you're not an island, especially as a new grad. It's a huge learning curve. And so having the understanding that it's like you need to be comfortable reaching out to your resources, and admit when you don't know something is very much like an essential part of being a new critical care nurse. And so that's what she relayed about me.
Perfect. If we called your last manager, what would they tell us about you?
For sure, one thing, he always said same thing to me. I am a great go-getter mindset person. So I, even if some challenges, I get excited. That's what he thinks. I'm like, I don't know I'm getting excited, but I do enjoy challenges, that's for sure. And I do love to do some research, try to find how I could fit, in and everything. So yeah, he really, every single actually, feedback, he always says I'm a go-getter person. The other thing he always said was I'm a very trusting, person. If he said something and, usually I can make it happen. And if I can, I will make conversation with him. I will come to him and, tell him my honest observation, or like it could be delayed, and I'm going to tell him beforehand. So he knows that what is going on with my project. So that was something that he really always said, that he really enjoyed working with me. I really enjoyed with him. I just happened to change the career. But yeah, we've been still keeping touch. And yeah, we have a really good relationship.
Just a slight change. Instead of saying trusting, say trustworthy.
Oh, yeah. Trustworthy. Oh, yes.
Yeah.
Yes.
If we were going to call your last supervisor or manager, what would they tell us about you?
So they would say that I'm a team player, that I love to help out, which can be like a downfall because I'll get behind on my own work. This was at the nursing facility, so that last manager, and I would get behind on my flow because I would spend extra time with the patients and talking to them rather than just kind of being like a pill shover, like, take your medications. I like to spend the time with them just to make sure too that they were still alert and oriented and nothing new was popping up. So I took my time with my medication pass. Very diligent, hard worker, very clean as well. I always made sure that the cart was clean when I got there, and also before my next shift, I liked to make sure everything was clean and making sure everything was documented too before the next shift came in.
So, you don't have to tell on yourself or say anything negative.
Okay.
Yeah, just say, basically what you said, just minus the negative part. So they would say that, and it went above and beyond in terms of building a really good relationship with my patients. That way, if there is a change from baseline, I know them well enough to notice changes in their orientation. And I would say that I'm really diligent. I keep my workstation very clean, and I'm very detail oriented in terms of documentation and reporting any assessment changes. Just basically all the stuff that you said.
Okay.
Yeah, because that's all really great stuff. Being a team player. And just FYI, the keyword that they're usually looking for with this question is dependable, reliable, that kind of stuff. Can you please tell us, if we called your manager and asked what they have to share with us about you, what would they say?
I would say my manager would, or / instructor would say that I am a very hard worker. I am very open to learning and receiving critiques. They would also say I'm a great communicator and also a really good team player, as well as also they would also say that I am
You can talk about being loyal and dependable and reliable.
Yeah. Okay, I can work that in there as well. Yeah. So I'm loyal, I'm very reliable.
And then maybe segue into the team player thing.
Yeah. But for that question, I think I would hound on my openness of learning and receiving new critiques, because during the clinical experiences, I was always asking all the nurses and my instructor, I was like, oh, is there anything fun or interesting to see? I was able to draw blood off an A line. That was really cool. That was really cool for me, seeing a blood off of A line, do it like allowing me to do like IVs, inserting Foley's. I thought all that stuff was cool and interesting, and I like was so very eager to like learn and like watch like the nurses or doctors do procedures bedside, that stuff.
Yeah. I have something for all of you that I'm very excited to finally tell you about. It's something that I've been working on for over a year. And this is great for nursing students who are just starting out. This is also great for the person who has an interview in a few days and is trying to put all of the pieces together so that they can be organized and confident going into their interview. And it is my solution to what I hear from all of these nurses that you see in these videos. They all tell me, I know something like that happened, but I can't remember it now and I wish I'd written it down. I know a lot of clinical instructors and nursing professors encourage people to write down their clinical experiences so that you can remember them later, especially when you're in front of a hiring manager interviewing for your dream job and it's something that happened, months or even years ago, and you want to be able to articulate it well. It can be so valuable to have everything written down. So I've made it's a hybrid between a clinical journal so that you can save all of your memories from clinicals, but it's also divided up by question. So for example, let's say you had your first rapid response that day, you would flip to the question section that says, tell me about your most critical patient. Write down everything that you can remember, while you're waiting for post-conference or whatever it is, whenever you have a few minutes. And then when you finally get that call out of nowhere asking if you would be open to coming in for an interview for your dream job that's in 2 days, you have everything organized. And then it's also a nice thing to have looking back, remembering all your first patients and the first time that you did all these different skills that you're learning. So I've tried to make it all cute and aesthetic for you guys. It also includes why they ask certain questions, what they're looking for, do's and don'ts for answering questions, and then it has clickable QR codes so that you can watch examples of how other people have put their answers together who've been successful in getting the job that they wanted through their interview style. So it is about 250 pages. It's also meant to be sort of a how-to DIY version of the online one-on-one coaching for situations where you may not necessarily want to hire a coach for your answers. It is a fillable PDF. It also has other sections like, frequently asked questions, things like what should I wear? What do I do if I'm nervous? What should I put in my portfolio? I could talk on and on about this thing. I've worked on this, like I said, for over a year. I'm really excited about it. It's finally available. I do have a discount code for supporters of the channel, currently for 50% off if you use discount code.